Today we're looking at the Eurus S1 holder type. Firstly, I'm going to show you something that's a little bit different to your previous Belmont products, if you've used those before, is that we have a master on-off switch on the spittoon housing here. We switch it on, and this is actually going to start off a whole system of checks and load up and boot up the software that's needed to get us to our start position. So in the meantime, while that's booting up, I'm just going to ask my colleague Patrick to come in, and we're going to talk about how to seat the patient correctly. As you can see here, the headrest position is fully down, and I see this a lot of times when I visit practices, and I want to show you something that can help the patient be more comfortable and you actually get more treatment time with the patient rather than having stops and breaks. Firstly, you'll notice here that if I lift this arm and swivel it out, it opens the chair up and Patrick can now enter into the chair. So a lot of times what happens in the practice is when the patient sees the headrest here, they notoriously put their bottom further down the chair so they can get their head into the headrest here. As you can see from Patrick's position here, it doesn't look overly comfortable. And also, Patrick has a large space under his lower lumbar here, so it's not supporting the patient very well. It gets worse when we bring the chair back into its start position. So as you notice here, as the chair comes back down, Pat's head is moving away from the headrest, and he's nowhere near where he needs to be to get into start position for the treatment. So there are a couple of things we can do. I know that's uncomfortable for you, Pat, so I'm going to bring you back to a nice position now. So we're just going to bring Patrick back upright and ask you just to exit the chair for me, Patrick, if you could. Thank you. So one of the things that you can do, on the side of the headrest there's a push button, a grey push button. That push button enables, if you push that in, it extends the headrest back up and down like that. So for someone Patrick's height, this is probably about the correct position. And on the side here, you see this grey squeeze mechanism. This needs to be squeezed and the headrest can be articulated forward. That can be very important if you have an older patient with severe curvature and you need them to get to a comfortable position. It can come right out this far. So this is about right for Patrick. So we're going to set that to there and ask Patrick to sit in the chair. So move the armrest again. Patrick, would you mind just sitting back in? Very important during this whole process that now Patrick sat in, that we ask, or the nurse or whoever is in the surgery allowing the patient back into the chair, to ask the patient to push back right into the lower lumbar. So if you can push your bottom back in, Patrick, that's great. Just adjust the headrest to make sure it meets. As you'll notice on the back of this particular chair, you have some stalks as well that are foot controllers as well. So with this one here, if I tap to the left, it gives me program position 1. And as you notice, as Patrick's coming back down now, the gap between his lower lumbar and the back support is now closed, and Patrick can reach, you notice he's come to a naturally relaxed position. So if he reaches to his left and to his right, the armrests are there, but rather than that, he's come to a more relaxed position. His shoulders are well supported, and he's sat nice and comfortably here. Now, one of the big problems for dentists, and particularly in the way that they're working, is that a lot of dentists end up in this position here, which is like basically, we call it the sort of question mark position. So it's curving your spine over just to see the upper arch. Now, if you use the headrest correctly, what you should do is if you're ever going to move the headrest when the patient's head's in the chair, make sure you support the hand underneath the pad. What I'm going to do is I'm going to push the bar in and tip the headrest back. Now see what's happened now is that I've actually changed the articulation of Patrick's head. So actually the upper arch is within direct vision. So I can actually see the upper arch. Now you will never get rid of tilt in dentistry. There will always be an element of tilt. But what you have to avoid is complete bending like that, because that bend is what will prevent your careers lasting a long time. It can be very painful and leads to lots of ongoing health issues. So how you sit and how the patient sits is really important. Now, when you maneuver the headrest and move the headrest, it's very important to remember that older patients or people with neck injuries will not be able to do this. So it's always best to verify with the patient before you articulate and move the head around. Now, for the lower arch, what I'm going to do is I'm going to pull the bar out. So I'm going to squeeze the bar out, squeeze the mechanism, and tip Pat's head forward like this. As you can see from here, I can now see the lower arch with much better vision. And that actually helps me as a dentist achieve a healthy position. Now, what we're going to talk about is the actual delivery system itself, the overpatient delivery system. As you see here, we have an arm that comes over the top of the patient, but doesn't actually close the patient into the chair. So on the front of the delivery system here, you'll see a little push button here, and you'll hear an air activation there. That is actually for lowering and raising the tray holder. So if you work on a higher position or a lower position, just simply press that button in. Also, another key fact with this product is that a lot of dental delivery systems have very upright handpiece systems like here. So when you're actually taking the handpiece system, you're actually twisting your shoulder and your wrist over to select a handpiece. With the Belmont S1 Eurus holder type, you can rotate that forward. And that basically means that you can take a handpiece much easier from the holder and place it back in the holder very easily. And of course, different height users may have different articulation needs. You'll also notice on this particular delivery head here that there is actually a very large tray that goes over the top of the patient's chest, this here. And some dentists really like this as a workstation so they can get lots of different surgical instrumentation or materials or whatever onto the top here, close to where they're working. So if you were a dentist working single-handed, it's nice to be able to have all your materials within easy class 3 or 4 ergonomic movement. Next, we're going to talk about the Belmont 900 series light. It achieves 39,000 lux. It has a sensor on-off, but you can control it either by the sensor. The nurse has controls, which also I'll run through when we go through the nurse's workstation. The nurse has controls of this light as well. It's important to remember Belmont lights tend to be best when they're at least 1 arm's length away from the patient. If you bring the light too far away, the intensity isn't quite right. And if you come in too close, you can get patterns or shadowing patterns on the light. So 1 arm's length away is all the light will really need. And you'll get the optimum position that fills the headrest. So it doesn't matter if you turn the patient to the left or to the right, the patient will be comfortable and they'll be able to see and not blinded by light coming into their eyes. Also, another nice feature of this particular light is a lot of manufacturers of LED lights set the intensity for the dentist. We don't believe in doing this. We believe in the dentist setting their own intensity. We don't know what the light is going to be in your room. So what we have here is we have on the back of the light, where it's illuminated green here, an intensity adjustment. So you can set it to whatever level that you need it to be. The optimum for you as a performing dentist is to have the light in the oral cavity being as close to the outside light that's out in the ambient light as possible. If there's dark out here, very bright in there, what will happen is you end up with eye strain from being too bright and then refocusing every time you pick up a handpiece. So just be aware the light is really quite important. Sometimes you may feel the need to place a composite and then you want to work the material and you don't really want it to set, so you don't want it to cure. So this light has what they call a cure safe mode. So again, I can do it without the touch screen until we run through the tutorial on that. But you hold your hand under the sensor and it steps down to 4,500 lux. Just another point that I wanted to add was with regard to the delivery system or the handpiece system is the positioning of that handpiece system. When the patient's exiting the chair, it's important to make sure that that's out of the way. If it isn't, their feet can hook into the hoses as they swing their legs out of the chair, and that's something that we don't really want to do. So another thing that we can do here also is just to show you the height adjustment here as well, because not only with the air brake can we get it to that position, but the chair can also raise much higher. So if there was any treatment that you were doing standing up, or maybe had an implant motor that you wanted to put on top of your tray, you have a great deal of adjustment here. Now we're going on to the nurse's workstation, which is shown here. Basically the arm can be manoeuvred into position, so if the patient was in supine, it can come out close to the patient's head. It can be folded back, tucked back under itself like this, or it can be moved completely out of the way if you're doing some treatment where you're coming from both sides of the chair, maybe a surgical. Here, I want to show you this arm here and this light. They're in conjunction. If this is lowered onto a stool or onto a worktop, as I'm going to prove here, when I lift that, it activates a safety switch here. This red light is a safety switch, so it means that the chair cannot move any further. It will stop the chair in motion. And that's to save this arm from breaking off if it gets lowered onto either a staff member or onto a work surface. It's a useful safety feature. Also, there is another safety switch. Before we talk a little bit more in detail, I'd like just to show you with the chair as well. So if this chair was lowered onto, let's say, somebody's leg or whatever, as it was lowered, there's a safety plate underneath the chair there. So if I use my foot to activate it, you'll see the red light comes on. Always worth knowing, a red light generally is something to pay attention to. Coming back to the nurse's workstation, we're going to show you here that the high volume evacuator has a 45-degree angle now to make that easier for the nurse to find position in the mouth. Sometimes what we find, one of the largest areas of damage in dental equipment tends to be suction hoses. And if you have the head here straight like this, which is what most high volume evacuators are, the nurse tends to bend the hose over like this to actually get into the patient's mouth where they need to. And that bend there can apply a lot of pressure to the hose, which over time causes cracking and replacement. So having the whole handpiece head that rotates to 45 degrees here is much easier for the nurse. They can come straight to the oral cavity without putting any pressure on the hose here. One other thing here also is these holders can come out for cleaning as well. So there's a little clip underneath the back of them. So if I pull that clip forward, the holder comes out, and it means that the nurse can wash down in between the holder and keep that nice and clean. It can be autoclaved. If you need to, it's autoclavable as well. We put that back in, and then we set our HVE. And it's the same for the saliva ejector as well, so you can get that back in. You also have this little nurse's tray here, which is quite useful for medicaments or for passing stuff to the dentist that's you've got it close to where they need to be. Also, the controls here that are necessary for the nurse. You do have the light control. Here there's a light symbol. The nurse can activate the light from there just by pressing it. They can turn it off from there, turn it back on. If they hold down on the light symbol, it will switch the light to cure safe mode, okay? And then activate back off again and back on. They have the cup fill and bowl rinse, which are kind of self-explanatory, and the chair program positions as well. So the nurse can be heavily involved in the whole motion of the chair and the delivery system. So I want to show you something else as well, that the spittoon bowl here, which is close to the nurse's workstation, can actually rotate right over the patient here. Now it's quite nice, sometimes patients struggle to actually get towards the spittoon. They find mobility is stopping them reaching for the... So here, they can actually get that rotated towards them to make it easier, so it's not, the patient's not missing the bowl. Also for cleaning, for the nurses, it's possible just to rotate this bowl, take the bowl out, and it can be cleaned and washed down And then the inner gasket here can maybe a little bit of silicone lube every now and again just to keep that nice and free. There's something else I want to show you while we've got this actually out here, is this actually rotates here, and the bottom below the spittoon, sometimes that's the most difficult place to get clean. But one of the things that Belmont have introduced is this screw cap that comes out from underneath, and it means that you don't get any residue building up. You can keep that clean and keep washing, and it's a very nice, simple little thing, and you screw it back on. Then when you're taking your bowl, you make sure your bowl goes into the center, then rotate it and firmly push it into position like this. It's important to keep this firmly in, because a lot of patients, particularly older patients, they hold on to the spittoon bowl while they're evacuating. So you just have to be aware that needs to be tightly in. You cannot have that loose in there, or a patient may end up pulling the bowl off. So if you're going to take the bowl off for cleaning, make sure you test it as nice and firmly in before the patient uses it again. The next thing we're going to discuss is the drop-down door, which drops down here. And this exposes our filters. So the filters that you need to clean. There are some filters here. There's a filter within the bowl that needs to be checked on a regular basis. Also, there's a cap that tops it to keep the filter in place. We'll move that bowl out of the way so we can get access in here. And basically, what we're going to do is take out one of the filters just by simply pulling it out straight. You don't have to twist or turn or unlock. It's a straight push and pull. There is a notch on the top that shows the right way of it going back in. Just push it back in. It doesn't need turning or twisting, that's it. I'm just going to raise the delivery system to show you a few items underneath the delivery system housing that might be of interest to you. The first one is the water control valves for the handpieces. So underneath here there are 4 valves, numbered 1, 2, 3 and 4. 1, 2, 3 and 4. On this side of the delivery system, you'll notice that we have a blue valve for the 3-in-1 syringe water and a yellow valve for 3-in-1 syringe air. To the inside of those valves, you'll see a plastic pot, what we call the oil collector pot. So you unscrew this and check it every week just to make sure you don't have a residual buildup of oil within the pot. If you do have a residual buildup of oil or a lot of oil in there, you need to check your oiling procedures and make sure the nurses are following protocols for the handpiece companies. Okay, to the front of the spittoon is this door, which can be pulled off here. This exposes your water bottle, which is, if you want to change your water, this is where you do it. So the first thing you would do is switch the switch off so it depressurizes the bottle. Then you will pull the bottle forward. There's a slider here which enables you to get better access to the water bottle. And then unscrew the bottle, fill with water, and then screw back on and push back in. Reactivate your pressurized switch. While we're here, don't forget that you need to check on your spittoon valve filter, which probably needs to be checked at least once a week. It's here. You undo the screw here, loosen the screw off and pull the panel back, and it will give you access to that filter. I'm quickly going to show you the differences between the holder type and the rod type. This is the S1 rod here. You'll notice on the side here that we have this black button. This is for the air brake, so for raising and lowering the delivery system. So you push in and then either lower or raise. The position that a lot of dentists adopt for using this system is transthorax, so over the patient here. And the idea is that in this position, you're able to reach for the handpieces without actually taking your eye off the field of vision. So the dentist is focused on the working area, or the hygienist is focused on the working area, and can come in like this without actually having to refocus their eyes. They can just reach for the instrumentation and pull it into a situation like this. Now, with the rod type, what you're trying to do is come into the tooth surface on the straightest possible line that you can, so you don't have any of this left-right pull with the handpiece hoses. So if I show you what I mean by that, so we're just going to move to position so that we can come in straight to lower right 6. So we can come in here, and it's a straight line, so it's not causing any stress to the wrist. And then if I want to work upper left 7, I can take it to here, bring the handpiece in, and then come in like this to upper left 7. So in a sense, I'm not having to refocus every time I take a handpiece. Now, a lot of dentists say to me that they find the over-patient position slightly intimidating for the patient. That's true to a certain extent, but it's more true if you have a headrest that's level and flat like this, because the patient's head is looking straight at the instruments. If you slightly articulate the head back here, you change the patient's plane of vision, and they're either looking straight up at you or at the dental light that's overhead, so they're not seeing the instrumentation. Now, if you are seriously concerned about the instrumentation being over the patient, you can actually take the delivery system, move it to the side here, and then you can use it almost like an ergonomic cart, really, from the side. So it's easier to get the handpieces over here and hopefully avoid pulling and twisting. One thing you will also notice with the rod system is that the weight from the handpiece is alleviated, so you don't feel the heavy weight of the handpiece in the electric motor. So it's a nice smooth movement and lightweight feel. So it doesn't actually put any pressure on your wrist in terms of repetitive strain. As far as controls are concerned, you have very similar controls to the S1 holder type, but your water controls are to the right-hand side over here. So your water switches are under here, and the oil collector pot is on the left-hand side.